Southern Health Link for chronic disease in the cell. So the grand challenge that we decided to tackle with our project is the Advanced Health Informatics Challenge. Our target population is adults aged 18 and older living in the U.S. Census South region with at least one major chronic disease, as defined by the CDC. So we chose this population because the South faces disproportionately high rates of chronic illness, and as you can see on the poster, the South accounts for 7 of the 10 states with the highest chronic disease mortality rate. Because these areas tend to be very rural, they often lack easy access to broadband and general digital literacy that you would see in more urban areas. So this applies to the Grand Challenge because it expands digital access in the underserved area. It integrates real-time patient data for better care, and it promotes health equity through inclusive informatics design. So our actual solution is a mobile health app and community health worker hybrid model. So the app itself is going to be based on open source resources like CommCare and OpenMRS, and will be relatively similar to something like MyChart and Teladoc. Mitch, would you like to talk more about that?
I would absolutely love to talk about that. Okay, so we made this little model of what our HealthLink app could look like with a system that basically allows patients to connect with community health workers in a way that is understandable. So, first of all, they're able to keep track of their medications and their symptoms with their healthcare provider, um, so that they can almost take control of it themselves and not have to go in to an office every time they need something. But at the bottom part, we also added this little map section just to show where your closest provider is, so that it doesn't make it seem like the only thing you need to do is stay on this app, and you still do need these like in-person visits. Um, so basically, the function of this app is in cooperation with these community health workers, which helps them basically understand what they need to do in order to keep track of their own symptoms, medications, and basically relay them back to the health worker. All right, so I'm pretty sure Hayden already said this, but there are many other apps that have tried to do the same exact thing as this, like CommCare and OpenMRS. Um, so it's like they're basically both used in like a similar way to have this offline use and like be able to be used by pretty much anyone, so that they don't need to have any higher education about what's going on with their body or anything. So we would consider this pretty feasible in that sense, that it does already exist and it has worked before. Um, but it does also cost a lot to implement the app, with a lot of maintenance, and basically just like the entire like use of community health workers that constantly needs to be ready to help someone. Um, but there are people who are willing to fund it, so we think that it would be feasible to get that money.